I posted this herb yesterday and a few of you got it right. This herb is Tremella. This is a herb that is great for nourishing the lungs and the stomach mucosal lining. Primarily the lungs though is where we're going to use it clinically. Think of the cough where it's dry and irritated, as if there's not enough of our moistening mechanism of the lungs. We did see a lot of this in the early COVID presentation, 2020, where it had the lingering effect of that dry tickle cough. Or you could think about it like the person who's deficient or who's run down, and now they have a lack of an ability to nourish the lungs. And so this is like a tonic herb. And it's important to think that way because so many herbs are addressing either a deficiency where we're trying to improve the normal function, or we're addressing something that's an excess. Maybe we're trying to remove something. This is your detoxification efforts or your antimicrobial efforts. This is only one of hundreds of pharmaceutical plant medicines that we keep in our pharmacy, our herbal pharmacy. And it's important to kind of remember that they're not really typically used by themselves. This would be made into a custom formula that is working at the root cause, maybe addressing parts of the hormone system or the vascular system or the gut system. You know, what are the contributing factors that are affecting the lung in the person that we're treating? You would never just give it by itself. That's kind of a Western herbalism concept, a high amount of a single herb, or what's the herb for the condition. Instead, we want to broaden our understanding of root cause. So you have to understand the physiology and what are the contributing factors. So when we think of Tremella, think of the case that's like a depleted, could be even an elderly person who sustains a chronic dry cough element. There could be other features that we're looking at together. Also, maybe when it comes to the stomach, this would be an irritated stomach that's now reached a point where there's gastritis or a compromised mucosal lining with inflammation. Once again, this herb would not be treating the cause of that irritation, which could be dietary, could be infection, something along those lines. But once they're in pain, it's important to build up that mucosal lining. And remember, this is in the tonifying category. And so we're trying to replenish that mucosal lining, trying to replenish that ability of the lungs to have the protective coating so that it can function better.